vision. So for tonight's Pass the Mic, we're bringing in the brightest minds in the area to teach us more. We understand the facts of the problem. Now we want to focus on how and why we got here. And to do that, we have an excellent panel of 4 experts to discuss. Karen Holmes, a transgender woman and advocate for the community. She currently works with Prince George's County Police, helping get sex workers off the streets in the Fairmont Heights area. Linda Scruggs, she was diagnosed with HIV and, more importantly, has lived with HIV for 31 years. She's now a community voice and advocate based on her experiences. Diane Young, a registered nurse who works for the Prince George's County Health Department. She got in this fight about 20 years ago when she lost her brother to AIDS. And Dr. Carlos Rodriguez Diaz, an associate professor at George Washington University's Millikan School of Public Health, who's been studying the disease for 20 years. I want to thank you guys so much for being here. And the numbers show extremely high rates of HIV in young LGBTQ+ Black men as well as other minorities. So my question, why does it affect these groups of people so much?
I'll take the first stab at it, Reese. It's really around the stigma associated with HIV. Even just being tested is stigmatized. So if you can't even get tested without feeling a certain way, how do you even get treated once you find out that you're HIV positive? And trying to get people into care once they're HIV positive to combat that stigma around being HIV positive is always a challenge. And our young LGBTQ community often goes underground because they're stigmatized and they're judged. And we need to get away from that.
If I can just add to that, I think also, it's the stigma, but also when you think about other minority communities, HIV has been stigmatized since the beginning of the epidemic. So myself as a heterosexual Black woman, making sure that people are not ignoring, what's happening. It's easier often to not address versus to address that HIV is in our community. It's in our community for a moment, but we can stop it. Stigma is a big piece, but also just lack of information and lack of self-identity. Part of my reason of coming out was to tell a story. I don't look like what I've been through. I don't look like someone with HIV, but because it's true, I also know that other people look in the mirror and think that they're not talking to me. They're not talking about me. So I think it's easy because we also come from a lot of other issues and trauma space as Black and brown communities and health disparities. So HIV is just another one of those health disparities that we're challenged with in our community.
And I know that the community, at least in the transgender community, a lot of people are assuming that that is a big issue right there in regards to HIV. You've got the sex workers that are out there working, and a lot of times people are thinking they're not being really that safe out there as far as having condoms on or not really doing it at all. I think we just need to really get the understanding of why the sex workers are out there and that to see it in a different view of things right now.
When you guys talk about the stigma and trying to defeat the stigma, that makes my mind go to 2 places, one of which is trying to get people the information and the truth and the realities that are involved with HIV and AIDS today. The other is about that perception. And as somebody that's a part of the media, I kind of take that part of it and try and own that part of it and how you can go ahead and change that perception in order to combat that stigma head first. And I feel like doing programs like this is one part of it. What more can we do to combat that stigma?
There's a racial justice piece here, right? So where HIV has been allowed to be. The African American Latina community, we're taking the brunt of this epidemic right now. Many of our folks are still thinking that it's someone else, but it really is. And race impacts that. Access, our zip codes, community, education, the social determinants of health are all inputted. And again, African American and Latina descent individuals take the brunt of that. So it really is looking at structural racism. It's looking at structural change and implementation, and also noting that one size don't fit all, whether we're talking about stigma, whether we're talking about treatment, whether we're talking about access to care and services.
And HIV awareness is extremely important. It should be in all conversations, all health encounters. Primary care providers have a very important role in opening the door for people to know about HIV, know their status, and then to stay engaged in care. And finally, I believe that we need to understand that we are not unidimensional, right? We are many things. We are man, gay, person of color, living in a particular place. And with that understanding is that we need to respond to the epidemic. So we work from racial justice, from LGBT equity, and for housing security, for food security, because all those elements influence how people interact with the world, including their health experiences and the healthcare system.
There are also a lot of people in and around DC and Prince George's County that are not in care, that they know their HIV diagnosis, they know their status, but some of these other structural things still keep them out of care. So I think part of what we're trying to say, that care is available. You can live a limited life expectancy with HIV. You don't have a limitation of life space. And I think that that's scary to people who still think that this is a death space. I love telling people that, it's been 31 years. The doctors were wrong. They gave me 3 years and they were wrong.